People are living longer than ever before. What's more, they're living with a combination of complex illnesses which are increasing the cost of providing the care they need. Our current health and social care system can't cope with these growing demands. But this isn't just about saving money. We not only want people to live longer, we want them to lead happier, more fulfilled lives, and we don't want their health to hold them back. That's why the Living Longer, Living Better programme has designed the One Team model. It's the biggest change to the delivery of health and social care in Manchester since the NHS was founded in 1948. Designed by health and social care experts, it's a common sense approach that aims to ensure that people's individual needs shape all aspects of their care. Meet retired postman Frank. He's 78 and cares for his wife Maud, who also has early stage dementia, as well as looking after the family dog Pickles. Frank suffers from COPD, a lung disease that makes it hard for him to breathe, as well as type 2 diabetes and arthritis. Maud tells everyone she's fit and well, but actually she has a bit of angina and bad hips and knees from her arthritis. Maud hates a fuss being made of her, but struggles to walk Pickles. Consequently, they both call on their GP's expertise more than most and are frequently found at the hospital attending outpatient appointments, scans and blood tests. Frank regularly travels to different health centres, sometimes on the same day, to be seen by community health teams for everything from podiatry to physiotherapy and nutrition. But when his chest is really bad, Frank rings for an ambulance, which frequently results in him being admitted to hospital. On these occasions, Frank worries about Maud and whether Pickles is being walked. He then has to wait to be assessed by social services before he can even go home. The result? A lot of unnecessary time in hospital. One Team is designed to make the Frank care receives more joined up and less stressful. All Manchester's health and social care providers are working together to establish 12 integrated health and social care hubs in neighbourhoods across Manchester. Each hub will have a neighbourhood team consisting of social workers, active case managers, district nurses and primary assessors, among others, who will work together and share information to ensure that each individual's needs are fully met. One of these professionals will take overall responsibility for each person's care. In Frank's case, this is Helen, a district nurse who designs a care plan which everyone who provides his care can all access at any time, day or night. Helen supports Frank and Maud to manage their own conditions better so they can keep active and don't rely so heavily on social care and health services. On one of her visits, Helen noticed that Maud was a bit quiet and it was clear her knee was getting very sore. Helen highlighted this to the neighbourhood team and without needing to attend her GP, Helen made sure Maud got some physiotherapy sessions and got her pain medicines reviewed. Maud was also seen by the local orthopaedic service who arranged for Maud to have her knee replacement surgery. During this time, Maud felt reassured that Frank was getting the help and support he needed at home. When Frank's health takes a turn for the worst, Helen and the rest of the team quickly put in place the care Frank needs to get him back on his feet again, which means no hospital admissions. Frank has the peace of mind that should he ever be admitted again, Helen will make sure that Maud gets the extra support she'll need from social services, as well as arranging for someone from the local Good Neighbour scheme to look after Pickles. And because Frank isn't worrying about what might go wrong, he can focus on keeping well. One Team recognises that some of the problems people face are less common, so services like reablement will be delivered at a locality level across North, Central and South Manchester, with teams located in the most practical care hub in that area. For the rarest conditions like sickle cell anemia, separate specialist teams will provide care on a city-wide basis. What happened to Frank? The neighbourhood team meet regularly with his GP to discuss the best options to keep him fit and well. His community health appointments are scheduled to take place at the same hub on the same day wherever possible. And should he ever need to go into hospital, he knows he'll be back at home as quickly as possible because an integrated care plan already exists. The result? Frank feels more in control of his life than he has in a long time, happy in the knowledge that his care is being managed in the most joined up way possible.